My name is Theresa Kossler, and I am a nurse practitioner with interventional cardiology at Prisma Health Heart and Vascular Institute. My education, I became a nurse over 13 and a half years ago. I received my bachelor's degree in nursing at a small college in Toledo, Ohio called Mercy College of Northwest Ohio. I was a nurse for over 13 and a half years and received my master's at Walden University. Interventional cardiology is a subspecialty of cardiology, and the main priority of interventional cardiology is to look into the heart and see if there are blockages in our coronaries, which is the plumbing of cardiology. And we use minimally invasive techniques to open up those blockages and allow the heart to start receiving oxygen and blood to the muscle. It has been fascinating to see the advances in interventional cardiology. Things have advanced so much, and it's really awesome because we can do minimally invasive techniques, whereas many years ago, you would have had to have open heart surgery. In addition to the heart, interventional cardiology can work on vascular, so blood supply outside of the heart. So in your legs, it can be your veins, your arteries. A lot of times people may have peripheral vascular disease related to diabetes. And with the vascular team, we try to prevent any vascular disease in your legs, your carotids, your gut. And what we do is try to prevent any blockages. However, if there is a blockage, we want to restore the flow to your limbs to prevent essentially an amputation. Columbia, South Carolina is actually number one for limb amputation. So here at Prisma Health, we want to improve those rates by providing special vascular interventions that are minimally invasive. I love cardiology because, one, I think it's fascinating that such a small organ is so powerful. I also like it because the heart is a central organ and affects so many different other essential organs. It allows me to use my critical thinking and knowledge to provide excellence of care to my patients. It is something that is very important, especially in South Carolina, cardiovascular health. And the other thing that I like about cardiology is that whether it's providing acute cardiac care or chronic cardiac care and preventing or treating and managing acute and chronic cardiac disease, it allows me to empower my patients with knowledge, and it allows them to participate in their own cardiac care. That way they can have the best outcomes as well. I allow my patients to be inspired by their own healthcare by allowing them to be a part of their own management. So I like to provide them a safe space where they can be vulnerable and transparent and honest. That way I can manage their care the best way that I can. And I feel very passionately about treating my patients and their family members how I would want to be treated. And that is ultimately by providing them a safe, non-judgmental environment. That way they do feel comfortable with me. I think ultimately that inspires many patients to take control of their health, is by having a provider that's going to listen to them and that is going to be judgment-free. So that's how I ultimately inspire my patients. When I'm not at work, I enjoy spending time with my husband and my daughter, Caroline. We spend a lot of time outdoors on Lake Murray. We like taking walks outside with our dogs. We also like taking day trips down to Charleston, Isle of Palms, Sullivan's Island. And I like to read, and I have found most recently that I have a little passion for some crafts. But yeah, I enjoy my free time as well. That way I can rejuvenate and be the best provider that I can be.